That was great, Arshya.
Yeah, thanks very much. It was an absolutely fascinating presentation, really interesting. One of the areas that wasn't covered that I just wondered if you could just discuss on is, particularly in Australia, a lot of our psychiatrists are concentrated in a few big cities. Now, I run a number of sort of more remotely located clinics, and one of the sort of limitations is actually getting to these places all the time. So are you able to make any sort of comment about the use of technology to more effectively sort of be able to sort of run sort of, I suppose, virtual clinics in a number of locations and be able to increase the mobility of, I suppose, psychiatrists, psychologists and some of our interventions?
Sure. And you mentioned your background was...
So I'm a psychiatrist and I deliver sort of TMS in a number of sort of clinics, and they're necessarily small clinics that involve a little bit of interaction from psychiatrists, but just getting to them back and forth is a huge sort of...
So your question is, how can we enhance how we deliver care to remote communities through the use of technology?
Yeah.
So things like telepsychiatry, telehealth come into mind. So a few years ago, I remember, thank you so much for the question, because it's important. And the reason why I kind of didn't touch it as much, because a few years ago, this was a big topic in terms of people said, but is it ethical? Are we going to miss subtle nuances when people are talking? Because as psychiatrists, I mean, or other clinicians, we are used to like listening to patients, feeling the ambience of the room. There's a lot of things that technology doesn't currently capture. And there's a lot of talk, people came up with a lot of ideas. In the US, there's a lot of companies now out there who are developing direct-to-consumer. Do you want to contact a psychologist or psychiatrist? It's an app on your phone. It's not even necessarily through a telehealth or telemedicine clinic, except they're limited because they can't prescribe some of the controlled substances. So I think that psychiatry, telemedicine, telehealth, it's definitely going to help. It's here, and when I say here, it's definitely in the US, and it's growing. There's a lot of investment in that, and how that's delivered is going to advance more and more with these different ways of capturing patient data outside of the consultation. So how much because face-to-face time is the cost, right, for companies. So how much time can they save by gathering as much data to present to you and say, hey, based on this, we have 4 composite scales, we have 4 rating scales, or whatever the data is. So you could review that in 30 seconds and not necessarily have to spend a lot of that company's time and money in some ways. But I think it's huge, and I think we need to do it because there's not enough human providers. Same problem in the US in rural states. One complication we have in the US that is being addressed is the fact that psychiatrists and other clinicians have to be licensed in each state. So at the moment, you can't necessarily deliver care if you're licensed in New York and someone's in Idaho, you can't necessarily deliver care there. And they're being addressed. I mean, it's in flux, but for many years that was the case. But yeah, telemedicine, telehealth is definitely coming. It's going to be important. Thank you.
Thank you very much for a very stimulating presentation. Thank you for coming such a long way. I actually think you're one of the best holograms I've ever seen.
Oh my goodness. My wife says that too.
Yes. I live and work in a very remote part of Australia. It's called Queensland. And I'm just fascinated by what you've said about the data sets and the cloud hosting. I'm just worried in Australia we seem to be like 100 years behind what you've actually presented there, because I'm fairly sure in Australia at the moment there isn't a public or a private hospital or a university that will host any of its data in the cloud. Just wondering how you've actually overcome that in the United States. I mean, it seems that it's very advanced, and most of what you've actually explained there, I'm just not sure they would allow it here.
Sure. So thank you so much for the question. Can I ask you what your background? You mentioned you deliver care in rural settings.
Yes, I'm a psychiatrist and I do work in a regional setting, but only about an hour away from the capital city.
Okay. I get the Queensland joke now. So first of all, I should put into context. So a lot of the things that I'm presenting are towards a kind of very cutting edge of research, or some of them are thoughts, like the quantitative mental state exam. I'm outlining how this could potentially be possible. Or these are research papers that recently come out. And there's always a tension between thoughts and possibilities, what's actually been researched in terms of evidence and what's actually in practice. And there's huge chasms between the two. In terms of the cloud, there are a lot of commercial and health organizations that have data in their own cloud networks. So there's lots of different clouds, like the sky. There's lots of different kind of cloud networks. And data security is actually very important. You may have heard, hospitals are increasingly being targeted by hackers and other organizations, having to give out millions and millions of dollars. So some Australian places may actually be doing some of this cloud hosting, or their IT departments may be doing that. But as a clinician, you may not necessarily be aware or see that, if you know what I mean. I don't work with any interface that says this is in a cloud or anything like that. I just see the electronic medical record, which is a topic on itself, and I'm not presenting on that because I hate all the electronic medical records. It's such a pain. That would be my thing. I think there may be some places here that are just as advanced as the US. My talk is skewed a little bit towards what is right on the frontier. So you may be seeing this and going, oh my goodness, because I had other people presenting in other parts of medicine, and they present, and I'm just like, am I redundant now? Like, what is all this stuff? But I think it's coming to all developed countries. A lot of the organizations that build these technologies, they go across borders. They have offices like Google and Apple and IBM. They have offices everywhere. And I've met various members of these different organizations while I've been here for the last day and a half. So does that answer your question?
Yes, I think it does. I was going to actually say that where I live and work, they're building a beautiful $1.5 billion hospital. It's the first greenfield hospital that's actually happened in Australia, I think, for a long time. And every person who's admitted to the hospital, everyone who presents to the emergency department, is going to be offered the opportunity to participate in a biobank. And they're looking at, if you present to the hospital at 3 o'clock in the morning with epigastric pain, what's the likelihood you'll come back in the next 10 years with myocardial infarct? And they've said that they're going to be mining large data sets, but I'm just sort of mindful about how much the privacy people actually let that occur.
Yeah, this is absolutely a trend that's happening, and privacy is a big issue. But I feel like people appear to be more willing to part with their data now. At one time, we used to be so much more cautious about where our data is going, but our phones and these other devices are just continually collecting so much about us. So I think it's coming, and people will sign up to that in large numbers, and people will analyze that data now, and depending on what they find at a later point, may go back to the data and reanalyze it. So this is something that's just going to get bigger and more available. But I'm excited. That's a trend that's happening everywhere, I think.
We've got time for one more question. Yeah.
Hi, my name is Nitin Dawadka. I'm a psychiatrist, mainly in urban practice. Thank you for your excellent presentation. I would like to bring into the conversation something which has not been mentioned, and it's a little bit of caution about the fact that using of apps to help critically ill patients can also have a disadvantage, a potential disadvantage. For instance, if you're using an app for someone who's suicidal, and if the app is not constructed properly or without any controlled studies, it can have a absolute and opposite effect. And similarly, the sensors, and therefore I just wanted to hear maybe a comment on what you perceive as potential pitfalls, considering that you're saying apps are being made dime a dozen, and by people who necessarily don't have the intellectual knowledge or information to make them. I just hope that this doesn't start having the effect of harming our patients rather than helping them, because as you know, psychiatric practice is mainly devoted to tailoring treatment to a patient. And I doubt if an app can actually tailor treatment to a patient. And I guess my doubts really are, in delivery of care to a patient with reference to these apps. Thank you.
Thank you. Thank you very much for your question. So there's a couple of different components there that I'll touch on. So you're absolutely right. Some of our patients, especially the ones that are most ill, are extremely vulnerable. So one of the things that's very remarkable today is the fact that all of you in this room teaching me and hearing from me, but also me telling you about some of these insights, and hopefully you're also on your guard now about some of these different things. So when someone comes up to you about an app or this other device, the landscape is a little bit more clear. There is a huge danger. Our patients can die just as easily as a patient with an MI, with untreated diabetes, any of these things. And especially digital technologies can help patients, can help and harm our patients. I searched Google for whether PTSD has ever been caused by an app. I just searched for it. I just wanted, because I'm seeing increasing immersive technologies, actually, not just apps on phones, but on headsets and virtual reality. And some of them, I've seen people have a panic attack, for example, using these technologies, because they're very increasingly real. So I searched, I didn't find any reference to PTSD in using app. And you think about it, these apps can just as easily have a negative effect on mood, on anxiety. They can make people not seek care. Oh, I'm fine because I have a phone. I don't need to call my clinician or speak to my nurse or talk to my psychologist. I'll just rely on this. And if this isn't good enough, they're going to have a problem. So we do have a clear role in terms of being allies of our patients and mindful about all these technologies and speaking up when something's garbage, because I do that. If something's not good, and I talk to a lot of different startups, and if they say, we've got this product and there's something that's fundamental, I say, you need to speak to patients or you need to speak to experts. And I do that a lot because, our patients will die. If people put out claims and things that aren't accurate. In the States, we've had a lot of controversies recently with billion-dollar companies that haven't lived up to diagnostic blood testing and things that they've kind of claimed. So we have to be able to scrutinize and think. But I thank you for your question. It fits into the very heart of how technology is moving forward for us to be able to put the real situation in front of the technologists and say, this is not the way it is, or our patients to say, this is not helpful for us.
I think that's a really great question, because really it's the intersection between psychiatry, technology, and it's the intersectional question that Theranos debacle is a great example where these claims were made. Elizabeth Holmes becomes an overnight billionaire, and the critical peer review aspect possibly wasn't there, because one wonders, how did it get so far? And now the labs are shutting. People obviously have lost their jobs, and Theranos is no more.
So everybody here has the ability to weigh in on any of these technologies. Everybody here has value, and this is something that I want people to hear to feel empowered about, because the experience that you have in seeing patients, being around patients or doing research, you'd be surprised in Silicon Valley how valuable that insight is. Because people sometimes don't know the very basics of what it is to be with another person in a room and talk about mental health symptoms, or to diagnose someone with a mental health condition, or be there when they're having a difficulty. People don't understand the mental health field, but they've got resources, they've got programmers, they've got technologies, and they want to try and do something, except they need us to be able to weigh in and give guidance. So every single body here has importance in that role, and you'll see more and more of it. So part of it's making us aware of it and making us be able to talk about it. Just even in these settings, just talking about, hey, what are the risks to our patients? What are the potential benefits? So there's many. What are the risks to our patients? What are the risks to their families? What are the risks to us as a community? Are we going to be sidelined by companies that typically disrupt entire sectors very quickly, right? You talk to a cab driver, a yellow cab driver, and they say, well, what does Uber know about driving cabs and the transportation network and we have to do this and that and license it. But these companies can come in very quickly and develop very quickly. They get things right, they get things wrong, but The problem in medicine is if you get things wrong, people die. And that's what we have to do.
Just a tidbit of information, since you mentioned PTSD, there are now well-documented examples of PTSD being caused by older style technology, which is the TV, after the Twin Towers. And not only that, these PTSD cases or patients have been accepted by insurance companies as bona fide and genuine. So this is older style technology causing a psychiatric disease.
And that's important. That's important for us to know. Thank you.
All right. I think I'm mindful of not cutting into your coffee time because, you know, when the limbic system isn't satisfied, you're not satisfied with the overall aspect. But I'd take the opportunity to thank Arshya.